Bulimia nervosa among teenagers in Malaysia. Bulimia nervosa is an eating disorder that extremely serious and life-threatening illness. A study by the Malaysian Psychiatric Association showed the disorder affected about 1% of the population in the country. This eating disorder was more prevalent among females. Bulimia nervosa is characterized by eating large amount of food, binge eating, and then offset this intake by vomiting, taking laxative or fasting or excessive exercise.
What are the risk factors of bulimia nervosa? There are many causes that can contribute to bulimia nervosa. Research suggests that a mixture of certain personality traits, emotions, and thinking patterns, as well as biological and environmental factors such as exposure to trauma or abuse, might be responsible. Psychological and emotional issues such as depression, anxiety disorders, and low self-esteem are closely linked with eating disorders. People with bulimia may feel negatively about themselves. Being overweight as a child or teen may increase the risk. The nature of our culture that is hyper-focused on teen ideal internalization and general social pressure for teenagers can also serve as a trigger for susceptible individuals.
Impact of bulimia nervosa. Bulimia patients might lose from about 25 to 50% of their body weight. If this illness is not treated immediately, it can have major bodily and psychological implications, with severe cases leading to death. The physical effects that commonly occur on them are as follows. Number 1, loss of appetite, to the point of not wanting to take any food. Number 2, injuries to the throat and gastrointestinal tract infections due to vomiting too often. Number 3, weak, not energetic. Number 4, difficulty concentrating. Number 5, menstrual disorders. And the last one is death.
Ways to overcome bulimia is by undergo treatment such as psychology treatment and medication. For the most effective treatment for bulimia nervosa is going to a therapy like talking to a therapist or counselor. Moreover, the patient also can have a cognitive behavioral therapy (CBT). The aim for this therapy is to teach patients new skills that shift their ideas about eating and body image. Also, those who diagnosed with bulimia nervosa can take medication treatment such as taking antidepressants that may help to reduce the symptoms. Some other way for the treatment is nutrition education, hospitalization. It may be hard to overcome, but with consistency to cure the disease, it may be cured.
In conclusion, many factors can cause bulimia nervosa. It can also affect themselves. Bulimia nervosa sufferers can recover, but it may take a long time. They have to change the way they think about food, change their eating habits, and if necessary, gain weight safely. The longer a person had bulimia nervosa, the more difficult it is to recover. So, act before it is too late.